I would like to call the Finance, Ways and Means Committee to order for March 12th, 2025. Madam Clerk, please open the board for roll call. Members, please record your attendance. Madam Clerk, please take the roll.
Mr. Chairman, you have 21 members present. You have a quorum.
All right. Members, just a reminder, make sure you are signed in, and also just to remind everyone that the presentation documents are on the dashboard so you can sign in and follow along. Are there any personal orders or announcements before we get started this morning? Hearing none and seeing none. We have two presentations this morning, so without objection, we will go out of session. We are out of session. We will ask the Department of Health, Commissioner Alvarado, I see you sitting there patiently, if you'll bring your team up. And I just want to remind our presenters that we will control your microphone. So once you see that red light come on, you are ready to present. We control those up here. And also I would remind the members that once you're recognized, you may go back and forth. And if it gets into running dialogue, I may stop you. But otherwise, once you're recognized, you can go back and forth. All right. With that said, Mr. Alvarado, good to see you this morning. You may begin.
Thank you, Mr. Chairman. Good morning, and good morning, members of the committee. Again, I'm Dr. Ralph Alvarado. I have the honor to serve as the commissioner of the best department in state government. That's the Tennessee Department of Health. And if you want, thank you, sir. I appreciate that. If you want to live the tenets of your faith in state government, then I would invite you and all members of the General Assembly to invest in our department. We live out and act on the biblical charge to help people at their most vulnerable moments. Accompanying me on today's presentation is my senior leadership team. Again, Dr. Tim Jones, who's our chief medical officer, Dr. Toby Amison, John Webb, Mary Catherine Bratton, J.W. Randolph, and then also Holt Witt, who's our legislative liaison. Many of you may know him and his team. They do a tremendous job here for our department. Mr. Chairman, with your permission, I'll begin the presentation. We have a total of 11 cost increases for the upcoming budget year. In Tennessee, I think right now, let me see if we can, there we go. And then we've got a few years ago, I think, in the first cost increase there, the governor convened a dental work group to provide a path towards reducing barriers to dental care in rural and underserved populations. The work group outlined recommendations that were included in a multi-year non-recurring pilot project. And the goals of the pilot program are to improve the pipeline of dentists in Tennessee, retain more dentists in Tennessee, expand services to rural areas, and expand treatment for underserved populations. The pilot program invests to the University of Tennessee and Meharry Medical College dental schools to provide continued expansion of dental classes. A portion of this investment supports student rotations at rural clinic sites throughout the state. It also invests in dental services for seniors through the Smile 65 Plus program and prosthodontic services for uninsured patients through a partnership with the Smile 180 Foundation. And there's also recruitment incentive programs such as the student loan repayment program that provide an avenue to retain graduates of dental schools in Tennessee for a time. So this proposal requests the scheduled fourth year of funding for the Healthy Smiles initiative. This initiative is working. The professional dental pipeline is expanding due to the pilot program investment. Expansions of dental class sizes have exceeded initial goals and projections entering the third year of the program. UT has expanded from 100 dental students per class to 130 dental students per class. The dental school had said 120 per class at the end of the pilot program. They've already exceeded that. UT has expanded the dental hygienist program annual class size from 30 to 45 with a goal of 48. And additionally, UT has opened a spring semester cohort of students the first time in their history. Meharry has expanded the dental class size from 62 to 75, which is a 20% increase. And Meharry is in the process of improving their expanded functions dental assistant class in the current year. The goal is to provide more versatile staffing to support dental needs throughout the state. Access to dental care in rural and underserved areas is improving due to the pilot program investment. Dental schools have expanded services to underserved areas through partnerships statewide, and UT has created multiple rotations to expand clinical opportunities to students in rural and other settings. Two UT-operated clinical rotations in Union City and Kingsport, rotations at the Cumberland County Health Department, other clinical rotations with nonprofit clinics in Chattanooga, Bristol, and Knoxville, graduate clinic rotations in Nashville and Memphis, planned clinic sites in Savannah, Pulaski, and Jackson. And UT stated that the funding provided by the pilot program galvanized dental school staff and alumni to create partnerships to expand work into rural and underserved areas. Meharry has worked with the Montgomery County Health Department over the last couple of years, and the school is coordinating efforts with the department to house faculty and clinical rotations in the coming months. TDH has actually hired dental staff rapidly, and Meharry continues to work with the department to fill in gaps where dental support is needed. So investments in dental care for seniors and specialty services have impacted thousands of Tennesseans, and recruitment incentives are placing dental providers in rural Tennessee. Through an agreement with the Tennessee Center for Workforce Development, the loan repayment program has signed 22 providers to work in rural and underserved areas. So a very successful program with that, and looking forward to continued funding for that. Cost increase number 2 is our Educational Dental Safety Net Care Fund. 3 years ago, the General Assembly set up a 3-year non-recurring allocation to Lincoln Memorial University Dental School to assist in creating opportunities for dental students to work in underserved communities through networks of rural and other clinics. The funding for this grant has been carried by the General Assembly and the administration since that time. So the department requests that non-recurring grant funding continue to be allocated to support LMU in providing dental services in rural and underserved areas. LMU has demonstrated a successful model in expanding access to dental care. LMU's efforts mirror the goals of the Healthy Smiles Initiative. Were not part of the original group. We've invited them to join the group, and they've been accepted into that group as well. And in 3 years, LMU has expanded their class size from 0 to 80 dental students per year, and the school has a goal of 120 students in the next few years. A minimum of 30% of those students must be from Tennessee, and a significant number of students express desire to remain in Tennessee to practice. And currently, LMU has 40 students providing some level of dental service, and the school hopes to expand that to 80 students. Through public-private partnerships, LMU is providing services through clinical rotations in rural and underserved areas. And in 2024, LMU has worked with over 2,400 patients in on-campus facilities, services provided in over 33 counties, supporting over 38,000 dental screenings, and provided over 2,000 restorative and prosthodontic procedures. They have a desire to work in TDH county health departments for external rotations as well, and the majority of grant funds are for school rotations and operational costs. The funding will assist LMU in continuing services in rural and underserved areas, and also to maintain dental school goals. Cost increase number 3 is for expanded cancer screenings. So this has been something that when I took over as commissioner, a lot of folks were asking, what kind of things do you want to work on? And one of the things that's killing people in Tennessee is obviously cancer of many types. We have currently a very successful breast and cervical cancer screening program, but we don't have anything regarding to address lung or colorectal screening. So this would be $2.2 million in recurring state funds. Our current cancer screening programs, again, don't address lung or colorectal cancer, even though lung cancer is the #1 cause of cancer incidence and mortality in the state, and colorectal cancer is ranked 4th for incidence and 2nd for mortality. This funding request creates a similar screening structure to the current breast and cervical cancer screening programs, with reimbursement of lung and colorectal screenings for eligible patients. Recurring funds will also support education, outreach, and awareness campaign services to promote the program and recommendation for these diseases. The department estimates this program will probably impact around 7,000 Tennesseans annually. Cost increase number 4 is the Juul settlement. The department's tobacco prevention and control program estimates that approximately 125,600 Tennessee high school students have experimented with e-cigarettes. Almost half of those students are current e-cigarette users. And in conjunction with the Attorney General, the department will utilize 5-year funding from the Juul settlement to create targeted programs to reduce youth vaping rates across the state. Through multimedia campaigns and cooperative agreements with school districts and youth conferences, the department will reach approximately 75,000 students with cessation messaging. Cost increase number 5 is automated syphilis testing. Nationally, there is a surge in syphilis rates requiring increased efficiency in testing. In fiscal year 2022, the department performed 64,500 syphilis tests. In fiscal year 2023, the department performed 72,300 syphilis tests. And this is a significant increase, with the expectation that the need for syphilis testing will increase at a rate of about 15% on an annual basis. Syphilis rates in the state are currently at an all-time high since the 1960s. With the surge in syphilis rates, the department needs to upgrade test kits and supplies to improve automation of syphilis testing. And automating testing will improve workflow efficiencies and reduce errors, allowing the department to respond quickly to testing requests. Cost increase number 6 is shared savings for nursing facility grants. As part of the American Rescue Plan Act, or ARPA, the department launched the Healthcare Resiliency Program. This program dedicated more than $250 million to improve the healthcare infrastructure and delivery systems in the state through competitive grants to various healthcare providers. During that competitive process, the department received over $440 million in applications, demonstrating a significant demand statewide. And last year, the governor recommended and the General Assembly approved a $50 million in shared savings funds to support grants to rural programs to build off the success of the ARPA-funded program. So the nursing facility grant program will target improvements in nursing facilities and the delivery of healthcare services for some of the most vulnerable Tennesseans. And through a competitive process, this program will provide grants to nursing facilities to expand facility capacity, improve infrastructure, promote workforce development, and implement innovations to the delivery of higher quality healthcare services. Increases number 7 through 11 are requests, again, to continue a lot of the Rural Healthcare Task Force initiatives into fiscal year 2026. All of these items are to be funded with shared savings. Number 7 is the Center of Excellence, funds supporting the establishment of a Center of Excellence. This would provide an array of technical support services to rural areas to tailor healthcare access solutions that address the specific challenges faced by local communities. The department's currently working on a competitive procurement to award a grant for the establishment of the COE. And to direct the roles and responsibilities of the COE, the department convened a steering committee, and this committee met for the first time in January and has scheduled quarterly meetings to continue to provide guidance to the COE going forward. Number 8 is a Center of Excellence Planning and Implementation grants. As the COE works with rural communities, there'll be instances where overcoming some healthcare access challenges may require additional planning and support beyond the in-house capabilities of the COE and additional funding to support local transition efforts. So this is going to hopefully help them issue those grants and have recommendations. Item number 9 is specialty care. So the department requests the continuation of funding to support an e-consult platform and incentives to improve in-person and telehealth specialty care services to people in rural areas. And a plan for the e-consult program has been created that will allow project access regions to conduct planning and implementation for e-consultations. The goal is for the contracts to be in place around the start of the new fiscal year. Item number 10 is rural healthcare training programs. A key component on improving access to healthcare services in rural areas is improving the pipeline of providers supporting underserved communities. So studies indicate that rural rotation exposure in training or in residency is positively associated with choosing rural practice. I'm an example of that. However, barriers including the lack of medical educational programs and minimal training opportunities and facilities in rural areas. So preceptors provide students with a lot of vital clinical education, which trains the next generation of healthcare professionals. And programs such as rotations, fellowships, and residencies can increase a lot of exposure for trainees to a rural lifestyle and medical practice to improve in-state retention rates for providers. So the department's in the final stages of an RFP for these services as well. And then item number 11 is for the Board of Pharmacy. It's a licensure of an ambulatory surgical treatment centers. Public Chapter 714 provided for the State Board of Pharmacy to license ambulatory surgical treatment centers. The fiscal note attached to this public chapter provided one additional regulatory position beginning in FY 25-26. This request recognizes the authority of the fiscal note and helps the board license approximately 150 centers. Those are the cost increases, Mr. Chairman. If you'd like, we can kind of go then into our reductions. The department utilized a lot of revenue. You can see the whole list. I won't go through all of them in detail, but you can see them on this page and the next one. The department utilized a lot of revenue swaps, historical underspending, and operational efficiencies to meet the reduction targets outlined in the recommended budget. These items were carefully considered to ensure that there was no impact at all on services provided to individuals. And a key item to note is that the department incurred these reductions without impacting services or funding to our metro health departments and to our county health departments. So we took one for the entire team there. We've got here, I thought I'd take an opportunity. I know we get a couple of slides to talk about other things. So I put up this slide, Mr. Chairman, because I think we're trying as much as we can to let people know what we do in the Department of Health. And in Tennessee, we take a lot of pride in our football, basketball, and our baseball rankings. We're also very proud of our burgeoning economic prowess and the top rankings in taxation, growth, job creation, tourism, economic investment. However, when it comes to health outcomes, we are firmly in the bottom 10. And this is the last of the economic pillars that as a state we must conquer if we hope to achieve our highest levels possible. So we aren't afraid to own up to our poor health outcomes, but we also know that we have the leadership, the knowledge, the resources, and the determination to make steps in the right direction. With your help and investment, we can improve. And we try our best to break down silos between departments and different departments and department heads. And I often convey to my staff that if any other department achieves its goals, the health needle in the state of Tennessee will improve. So it's in our interest to see every department be successful. Now, our local health department staff provide a tremendous number of services, including all that you see here on this list. Our employees have complained that people in our state don't know all that we do in our health departments, and we are the only state in the union to provide primary care services in our health departments. We operate 56 clinic locations in Tennessee and 16 federally qualified health centers. We also provide dental services, treatment for sexually transmitted infections, HIV testing and treatment, tuberculosis testing and treatment, family planning services, various immunizations, breast and cervical cancer screening, screening, and our WIC program, which has become very popular here lately. We've had an 18% surge in signups for food nutrition for children. We house navigation services for people with dementia, care coordination for children and young families, naloxone and fentanyl test strip distribution. We handle reportable diseases and investigations, emergency preparedness, environmental health, and community health planning and engagement. And also, in addition to these services at the local health departments, our staff is also fully engaged in a number of activities: disease prevention, vital records, oversight of professional licensing boards and investigations, providing and processing data, community engagement, running the state lab, restaurant inspections, which is often the most popular article anyone's going to see in the newspaper from the Department of Health. They want to know how their restaurant did. Maternal child health, engaging young people and older adults to support healthy aging across the lifespan, and so much more. So if you've never visited your local health department, I would ask all of you, please stop in and pay our staff a visit. You will find that they are the most selfless public servants who are all mission driven to protect, promote, and improve the health and the well-being of all people in Tennessee. Now, Mr. Chairman, we all know that there are several changes occurring at the federal level, and with change always comes some angst and some worry. And I've been reassuring my department that we do not improve without change or challenging the status quo, if you will. That's how we've always evolved. My son and I recently had a conversation in which he asked me, based on what's going on, would you rather have low to no, which one would you rather have? Low to no obesity and low vaccination rates, or high vaccination rates but high obesity? And I think that's a difficult choice by today's standards, because heart disease and cancer are still our number 1 and number 2 killers today. And they're responsible for roughly 60% of the deaths at most years in Tennessee and the United States. But obesity is one of the principal risk factors for a lot of these disease states. But by historical standards, I think the answer is a bit easier. Medicine and public health have been two of the greatest forces for improving the quantity and quality of human life in all of history. Over the last century, we have gained 30 years of average life expectancy, and about 25 of those years are attributable to public health intervention. Things like cleaner water, cleaner air, improved hygiene, food inspections, improved nutrition, vaccinations, and fluoridation of water supply. In 1900, there was very little obesity, and there were no processed foods. But there were also no vaccines or other public health interventions, and our average life expectancy was 47. By 2000, our life expectancy was 77 with public health interventions, even though we were fat and ate processed foods, is what I tell people. So I think in the end, we can have the best of both worlds. But these are the things that we're trying to achieve, and kind of to prove the effort of what we have. The strip in the red might be things like antibiotics, early maternal care and prenatal care, and those kinds of things. But I think a lot of public health has achieved a longer life and higher quality life. Mr. Chairman and members of the committee, thank you for your kind attention. We're here for answer any questions and your kind consideration of our requests.
All right. Thank you, Commissioner. Again, thank you for being here, and thank you for your presentation. I'll begin. We have several folks that are getting on the list, but I'll begin this morning. You talked about the dental program and some of the numbers that we've seen from all the cohorts, whether it's LMU or UT or TSU, all the McNary, all the ones that are providing dental care across the state to those who really need it. So this is year 4, moving of 5. So what do you see coming down the pike? I know the numbers, from all the institutions that are jumping in. Where do we go from here, though, to continue to move the ball, to continue to move the needle?
Yeah, so it's a situation that I think when you have a program that works, we always talk about wanting to have data. When we lay down an investment, we say, hey, show us that this is actually giving us a return on investment. I think at this point, we see that it has. We had several vacancies in a lot of our health departments. You have beautiful dental operatories, and we had no dentists. I think Smith County had an operatory that had not had a dentist since 2007. And now has a dentist for the first time serving people in that community because of this program and because of the incentives. The loan forgiveness program is tremendous. If we have had dentists from out of state that have come to Tennessee to practice because they have a lot of school loans, the average debt for a dentist is about $300,000 coming out of their training. This offers $100,000 per year for 3 years if they want to serve in our health departments. We had numerous vacancies. I think we're down to 2 existing vacancies still. I think they're in West Tennessee. And we have lots of other dental operators who would like to have dentists who will probably request for those if we have more demand. I've had a chance to visit a lot of RAM clinics, which are regional area medical clinics. Dentists come there and we tell them about our program. We're one of the only departments, I think we're the only department in the country that does dental work within our health departments. And so people are looking that want to serve in that capacity. So I think there's going to be a demand the more the word gets out nationally. If we want to attract more dentists, some of this is going to have to continue even beyond the pilot. And again, as we're laying down data, we're already seeing the information that's there. It's enough for us to say we probably need to have a continued investment moving forward. Some of this is going to be taken care of that we have higher total of students, so that adds some more tuition for the faculty to be covered. But again, some of these programs are things that we want to continue to do that. We have a tremendous need. Most of our counties are designated as a shortage area, and I think we're short about 700 dentists statewide. So the more that we can do to invest in this, it'll make a huge difference. But we'll likely, at some point, once this pilot is finished, and assuming you continue to fund it, we'll likely have really good data to say this is what we need to continue to do moving forward.
Great. Changing gears just a little bit to FSAG funding, the department was allocated $730 million in ARPA funding through FSAG. $120 million of this was to be allocated for healthcare facility staffing assistant grants, specifically, again, for long-term care facilities. At the July 2024 FSAG meeting, $21.4 million of these funds were unspent and reallocated to new projects. Can you talk a little bit about why were these funds unspent?
There's and I have John Webb, who's our financial expert. I'll probably ask him to comment on this in just a second. A lot of this, I still work in long-term care myself, so I still practice some, and so I understand the world that they're in. A lot of folks that are there typically are not used to applying for grants, I think, and following through on a lot of the paperwork that's required. I think the perception from a lot of our partners there was that, hey, if I get awarded a grant, I just can issue that and you'll send me a check. Obviously, with ARPA, it'll be the most audited program in federal history, probably. And there's we wanted to dot every I, cross every T, follow every rule that the federal government set for us. There was a lot of paperwork, a lot of requirements. It became frustrating for a lot of folks there. And so for some of them, if they couldn't supply the information that was required, a lot of the receipts, some of that funding, even though it was originally allocated, they were not eligible for after we found out, or they didn't provide enough information. There's also a lot of turnover in staff. You'd have someone who would apply for a grant, and then the next person, they leave, another person would take that job, didn't know about the grant, didn't follow through. We would ask for information. I don't want to do all that, and they got rejected. So those are some of the things. John, I don't know if you want to kind of talk a little bit maybe about some other issues.
Yeah. John Webb, Deputy Commissioner. Part of the reason for the reallocations, we had a lower participation rate than what we expected. And I can't remember the percentages right off the bat, but I think it was somewhere around 60% of eligible facilities applied for the full amount that they were eligible to receive. And so once we kind of ran the numbers and we got later into the program, we made a projection that they would be about 21 million underspent, and that's kind of where we landed. But participation was one of the big reasons why we were able to reallocate that money to other programs.
Okay, and then can you talk about also 129 million was also allocated for the local health department capital investments, but it looks like 440,500 went unspent. What about those dollars being unspent?
We had those set aside for staff.
Okay.
And when we looked at our projected expenses for the life of the grant, we realized that we probably wouldn't need that money. And so we put it back into the pool.
Okay. And then can you talk a little bit give us an update on the new state public health lab?
Yeah. So we've broken ground on that. We've very excited. It's a $200 million investment. I'll again commend the General Assembly, having served in a similar capacity in another state. That request was made there and not honored. A lot of states requested it. It wasn't done. I think this state had a lot of vision in getting those funds to be used. Our state lab is state of the art, and it's a regional lab, an international lab. It's a resource where people sent from multiple states. We do bioterrorism testing, a lot of things that's done. The people that are there are tremendous. And so to invest in that, to create a bigger facility, the current facility was an old tuberculosis hospital. It's on its last legs. It looks nice from the outside, but the internal guts of it it's in really bad shape. So it's good timing to build a new facility, but the ground has been broken. And from what I understand, we're on budget and things are within on time as well right now. So we're very excited.
Okay. And then my final question, and we'll move on. $20 million was appropriated for the Knox County Forensic Center. And from what I'm seeing, as of December the 31st, 2024, zero had been spent. Can you just, I guess, update us on that project of why no funds have been spent?
Sure. Mr. Chairman, Knox County, I think where they are in the process now, they've issued a bid that I think that went out on February 12th. They're going to make the award in the next few weeks. And I think once we get that award made, then we'll start seeing more and more, I guess, reimbursement requests from Knox County, and you'll start seeing that number go up. And in conversations with Knox County, we're confident that they'll spend the $20 million before the December 31 deadline.
Okay, that was going to be my next question. All right, thank you. Let's move on. The next person on the list will be Chairman Williams. You're recognized.
Thank you, Thank you, Commissioner, for coming today. Really appreciate your service and the sobering reminder of about our health statistics at the end of every budget presentation. So appreciate the hard work that you're doing there. I did have some questions about shared savings. So last year we set aside, I think it's $57.3 million for utilization of shared savings. There's another $50 million this year for nursing facilities. Of that 57 last year, we were going to invest those monies in our rural healthcare resiliency program. I wondered if you could give us an update on those grants and how it's going. As you're well aware, rural healthcare is just getting more and more challenging on every day. And so I wondered if you'd give me an update on what's going on there.
Certainly. So thank you for that question. Actually, we just finished issuing the awards for those, a very popular program. And I think people haven't been accustomed, the department hasn't been accustomed in the past to be able to have this. So it's exciting for us to be able to provide these investments. So in total, there were 145 applications for the $50 million in the HRP. It was, I think, over $332 million in requests, to give you an idea of the demand for it. There was just one award for every 6.5 applications. There are really dozens and dozens. I'd say there were very few that were not excellent applications, all worthy of those kind of funds. They've been very successful in driving applications from awards to rural and at-risk and distressed counties. So I think 6 of the 7 counties with the most applications were at-risk or distressed. All distressed counties were represented in at least 17 applications. All rural counties were represented in at least 9 applications. And all 89 rural counties are touched by an award. 58 are represented in 2 or more. 100% of the 23 awards touch an at-risk or distressed county. And all 9 distressed counties are represented in at least 2 awards and as many as 6. So they all have common needs that are identified by their local county health council. So if you're not familiar with those, every county has a health council that convenes volunteers locally, made up of people from law enforcement, hospital, public health, nonprofits. Anyone you can imagine is welcome to those. And they often work on things that are important for health in that community. And so they'll do assessments in the community and then develop an improvement plan. We try to make sure that we drove a lot of those that would be in alignment with those health council objectives. And so those things were aimed towards addressing things like social drivers of health, preventative services, behavioral health and substance abuse services, mobile medicine and services, integrated care, one-stop shops, transportation support, those kinds of things. So a lot of work was done on that front, but it was a very, very successful. I mean, there's always, after these happen, I think a lot of people are disappointed because 23 got awarded. That means 122 did not. Mm-hmm. And the process was done kind of in a procurement process. It was 3 blinded judges who reviewed it. We had kind of our bit of our rubric, and then they scored them independently. Those were then convened by a procurement officer. It was all, again, I didn't know all of the awardees until the day before it was released, but then those went out. And so every county is going to be represented and the need for it. I think, again, we have 332 million worth of requests. It's just an idea that if we want to continue this, there's an appetite, and it's going to help improve the delivery of care and provide a lot of resources for people in rural communities.
Yeah, thank you, Commissioner, for that. I do thank you for sharing the total number of projects. I do think that the number of projects that were requested and the total dollar amount requested is, I guess, a picture of how challenging it is in rural health today. And so I guess my question to you would be, given there was such a huge request and this was one-time funding for last year's budget that we're spending this year, do we or maybe there is outgoing. I guess I'm not really certain of that. Is there an expectation to extend that, or no? Or are we just doing that for nursing facilities next year?
The current request, I think, from the governor is for nursing homes, for nursing requests.
Mm-hmm.
But clearly, said if you all control the purse strings in state government, if there's an interest in doing more of these types of projects, again, with the original federal ARPA funds, it was $440 million request for 250. This was 332 for 50. And I think they know the difference that federal is a lot more paperwork. State's a bit easier of a grant process. Mm-hmm. But there's always going to be a demand clearly for this. And again, a lot of these are just to provide transformative ideas to help support folks in rural communities to address a lot of those issues that were particularly there. They were also, the grading was a bit more weighted toward the more rural and the lower your population density, you got a little bit of an extra boost on your score. So these got, I don't have a map of it, but if you see the map of where it's impacted, it's tremendous where they got at least 2 awards. It's definitely in Western and East Tennessee and all those very rural and distressed counties. So it's really exciting for us to see this. But if you pour more into this, we'll be able to get it out and do it well.
Well, thank you. And definitely something to consider. The the nursing facilities money this year, my assumption is it would be distributed in a very similar fashion, similar rubric and those kinds of things. But who would be the end user for these grants based upon your view? Is it, if you could help me better understand what those monies would be going for?
I think the way it's stated is to help with can be brick and mortar investments, or infrastructure investments, can be for workforce development. Again, just transformative ideas. They want to try different things. We've already had a meeting, I think, with a lot of the folks within skilled nursing, just to tell them, hey, listen, there was a concern before where all the funds were not applied for. We want to make sure this is a state grant, a different process. We want to make sure the word gets out to make sure that there's a need, that you please apply for these funds. And so we had a good conversation with them to make sure that it's as successful as possible. But it's going to be a very similar method. And I've had a chance to meet with directors of nursing at some of our universities that have got some innovative ideas on how they can channel in nursing, because that's the biggest challenge, I think, for a lot of nursing homes is, their nursing assistants and getting nurses to work in these facilities. The perception is, well, you just, go get them. You can't pop them out of a gumball machine. These are individuals who want to go work,
Right.
And you have to have a passion for that kind of work as well. So we're trying to find ways to connect a lot of that. But it's going to be a competitive process to apply for those, do a very similar model, and then be able to issue those dollars out there.
So would those be? Sounds to me like that last year the rural health monies was more of like capital expenditures. Are you envisioning, if this is workforce development, this is more standing up workforce development, or is it also? Could it also include capital?
I know, John. Go ahead. You want to kind of, yeah.
Yeah, Chairman Williams, it could be any of that.
Yeah,
okay.
In the current round, it was capital, workforce development, or enhanced care delivery.
Mhm.
Same kind of setup for nursing homes. I think one good thing about this, last time when we did the ARPA capital projects for nursing homes, there was a match required. There will be no match required. And so we're hopeful that will help incentivize folks to really apply for this.
Based upon the success you saw in the other program, based upon the number of applicants, do you think the money goes further if we cap the number of that someone can request, so it's more like a match or a share than it is a single investment from the state?
I mean, we haven't done that in the past. That was a question that was asked specifically by the facility, saying, "Is there going to be?" And I said, "Well, right now, the way it's proposed, there is no cap on the total amount, but I think we've been very careful. But some of the projects require larger amounts. So we've just been able to score them and see how much of an impact they're going to have. But we've never officially capped it. But that's up. I mean, most of the awards, I think, even in our ARPA funds, one of our largest awards, maybe $9 or $10 million, I think was the largest one out of the $250 million that were allocated. So that was the largest one that was given out. There were some requests for as much as $50 million on one of those projects. But if, again, that's up, whatever you tell us to do, we will happily do. But we've typically been very good about making sure it doesn't get too large, but we've never put a cap on it before.
Okay. Thank you. Thank you, Commissioner.
Thank you, Chairman. And members, our list is getting longer. We have plenty of time, but I just want to make sure that for the members that we ask questions, just ask pointed questions, and then I'll ask our speakers to just, the quicker you can answer, just to make sure that everybody gets on the list, gets heard. All right, let's move right along. We'll go to Chairman Hale. Chairman Hale, you're recognized.
Thank you, Chairman. First of all, thank you, Commissioner, and also a shout out to Grayson for his availability and always willing to help. Couple of things with we were in Smith County together for the mobile vaccine van. Can you kind of tell of the success of that and how that's going?
Yeah, tremendous. I mean, when that got developed, it's an opportunity just for staff, mostly for people in a nursing facility, for example, that have a hard time getting off of shift to get their own vaccinations. It assisted a lot of the medical staff people to get them on site. And they've been very successful at getting that done, able to go to people's homes that have a hard time with transportation, to be able to deliver those vaccines right to them. So we often talk about in the Department of Health, we want to meet people where they're at. Having those kinds of mobile vans does just that, not only for people that are at home and maybe have a hard time getting up, but also for employees who have a hard time leaving their place of employment to get that done.
Okay, thank you. And then going back to Chairman Hicks's remarks, and you mentioned Smith County with the dentist. And that was just kind of getting off the ground when we were there at the health department, even before their expansion of the building and stuff there. So can you kind of tell how that, now that we've got a dentist there, the success that's being there for Smith County?
He's full. I mean, so his schedule's full. I mean, it's people haven't. It's first getting the word out, but once the word got out that there's a dentist in town that can provide these services to the Department of Health, his schedule is instantly full. So I know they're very busy. They're very excited. We're excited. I mean, you can imagine having beautiful equipment, and beautiful operatories sit vacant for almost 2 decades, and to have suddenly someone come in and be able to provide care for people who otherwise can't get dental care, and they do it right in their home community, in their local health department, is unique to Tennessee. And it's just very exciting for people in rural communities. And like I said, we're down to 2 vacancies remaining of those that were available, but there are other health departments who have vacant operatories. So we may have to, if we fill those 2 vacancies, we may have to come and request more positions to be able to fill those in other counties as well. It's been very successful.
Okay, final question, if I can, Chairman. 2 things. The Verizon system's been in work, and some folks may not know what that is, but the death certificate system and stuff. So kinks, any issues, or those things working much smoother now, and doctors getting into the system? And I know that's kind of been a headache for some of them, and pushback maybe that they just don't want to have to go through the process to log in and do. So can you kind of hit on that just a little bit with that? And then also, Grayson and I had the conversation about electronic amendments, being able to get those done more timely. So and that's my final question.
Sure. Dr. Amoson will be our expert on that. I'll let her kind of comment here in a moment. But I think we've got Dr. Lewis, who's kind of an expert nationally, really, who gives a lot of talks about how to properly fill out death certificates and information for providers. It's hard. Having practiced, I know it's difficult that when you get a notification, it's a matter of just logging in and putting that in. It's how to fill out the information on death certificates. We're trying to make it as easy as possible that you can do it on your cell phone. So if someone can do that, so they can get a notification, do it right there, and be able to submit it. We want to get things as timely as possible. Obviously, a lot of families are dependent on those death certificates to be done within a 48-hour period of time. We give a bit more grace than that for a lot of our physicians need to fill that out, but we're trying to be as quick as we can on that. Dr. Amoson, I don't know if you want to comment any a little bit on that too.
Thank you so much, Dr. Amoson. Okay, Dr. Amoson, Tennessee Department of Health Deputy Commissioner. So the VRISM system has been significantly improved. We're continually trying to improve it. I think there's usually a lot of, there's usually a little bit of resistance anytime any new platform gets developed. But we are, Dr. Lewis and Gray Bishop, who's our state registrar, are continually working to try to improve the access and also training, especially for those younger doctors who are working in the emergency department or those who are out in the community. It's any new thing is always going to have a little bit of a challenge in terms of uptake, but it's continuing to improve. Just want to brag on our Vital Records folks, because they've been dealing with a tremendous increase in volume over the past several months. So thank you so much for all of your support for them.
Thank you. Thank you, Chairman.
Thank you, Chairman Hill. Next on the list, Representative Shaw, you're recognized.
Thank you, Mr. Chairman. Thank y'all for being here, and thank you, Doc, for all that you do for Tennesseans. Can you talk a little more about your dental program, and are there anything in the hopper right now for the rural distressed counties when it comes to the dental program? I'm not for sure. I'm just trying to gain some information. So can you talk about a little bit more about that?
Sure, happy to. We have a dental work group that meets twice a year, and it's comprised of the members. Now, LMU is part of that group. UT is part of that. Meharry, we have a lot of nonprofits who do a lot of dental work, who convene together. That group is constantly evaluating where we have dental deserts and we don't have enough dentists. A lot of that is in West Tennessee. And so they've identified locations where they're hoping to open up clinics that will be able to provide a lot of that dental care through the universities as well, and through private partnerships in the area. So there's a lot of work again, I could give really long presentations on some of this, but there are regions they're looking to invest in. Several of those will be in the western part of the state, and hopefully have them where everybody's within an hour's distance of one of those facilities. They're also working with us through health departments. So again, as we have a health department that has a dentist, people can go there as well if there's one that's local. But they're identifying constantly in East Tennessee quite a few that have been set up, and they're looking at West Tennessee to expand those. We meet every 6 months. There's a constant flow on that. A lot of the funds that are being used to the pilot project help to fund those facilities. And so we're constantly looking, but we have a desperate need in the state, and we're hoping to fill that in as quick as possible.
How about the training for new, is that involved in the program as well?
Yes, a lot of them will rotate through our, they have to have a certain amount of chairs present in the actual the health department there. If they have enough, they can have then an attending oversee residents who are doing the work. And so there's a constant education that's going on there. A lot of the new dentists that we've hired are younger and are eager to teach other students as well. So there's an opportunity to constantly educate the next generation coming through of dentists, and it gives them an opportunity. And again, the gratitude of the people that we serve is incredible. You can imagine if people don't have a smile to suddenly have teeth, have a smile, can eat again. It's transformative for them and for their confidence for the workforce. A lot of people don't seek jobs because they don't feel confident with that. Suddenly they have a full smile and they're eager to go apply for jobs. So it has multiple benefits economically as well, and just really exciting. But the opportunity for students, for residents to come. We have RAM clinics, which I mentioned earlier, very successful, huge. Knoxville has a huge they put on multiple, I think people from 11 states come here to get dental care, vision care. They had 60 operatories set up and if you've never been, it's really a remarkable sight, but a lot of people from all over the country, dental students and residents. And when they get there, I show up and talk to their deans and say, hey, we need dentists, contact me. We'll have them come and work in our health departments. And a lot of them enjoy that public work in health departments. So we're hoping to attract people from out of state to come here as well. So again, a lot of opportunities. It's a matter of, as we start to lay down this data, we'll have all that information once this pilot is done to have a formal report for the General Assembly.
Thank you.
Thank
Thank
you.
you, Mr. Chairman.
Thank you. Next on the list, Chairman Hawk. Chairman Hawk, you're recognized.
Thank you, Mr. Chairman. Commissioner Dr. Alvarado and your team, thank you so much for all you do. From all the information you've given us, we eat too much, we smoke too much, and we don't get enough exercise.
Yes, sir.
And
That's right.
I think that's what resonates with me. And as I'm concerned about health outcomes, I've got two questions, and I'm going to ask them at the same so you can answer quickly. But health outcomes, and that's been a very tense and critical issue up in Northeast Tennessee. If you could tell us a little bit about what we're doing to work on measurements of health outcomes in Northeast Tennessee is the first question, and how we're hopefully getting over some hurdles in improving health outcomes in Northeast Tennessee. Number two, you spoke a little bit about some of our youth education programs, but what are we doing to ensure the next generation doesn't eat too much, doesn't smoke, and gets more exercise than their parents did? So I'll leave it at that. Thank you, Chairman.
So that's a good open-ended question. I'll try to make this brief, Mr. Chairman, because I can probably go a while on this too. A lot of work that we're doing. Obviously, the number 1 and 2 killers for us are cancer and heart disease. What's the underlying cause of that? Tobacco is the biggest underlying cause of that. So we have a really successful program. I was just up in Gatlinburg talking to 600 high school students there that are part of our Tennessee kind of strong youth ambassador program that work on making sure that there are good examples to others for not using nicotine. A lot of members of the band, members of the football team, baseball team, kids with influence within their own realm to influence others not to use nicotine products and the risks of that. We talk about vaping. Vaping has always been labeled as the harm reduction, and it's not a harm reduction. 15 years of data now has shown after 107 compiled studies that causes the same outcomes as combustible cigarettes. And if you use them together, even that much more of an additive effect. So we're trying to teach use kids to influence other kids to do that, to help reduce tobacco use. Obviously, we're always constantly working on our vaccination rates. Only 26 of our counties now are meeting the threshold of 95% or more for pediatric vaccines. So we're constantly trying to educate folks. People have a lot of questions, a lot of concerns on that front. I don't dismiss those concerns. I mean, we need to engage and to show what we know. But that's another big thing. A blue zone movement up in Sevier County that's happening. Sevier County local government there has decided to go ahead and start becoming a blue zone. That is to teach people how to, age well from the time you're in your mother's womb, how to eat properly, exercise, form a sense of community. Isolation is killing a lot of our folks as well. But if you're isolated and you don't have friendships, it's equivalent to smoking 15 cigarettes a day. So a lot of our kids depend on their cell phone. That's their best friend and not others. Again, Gatlinburg in their high school, what I noticed when I spoke to them, not a single kid was on their phone when I was talking. And I was pretty impressed. And I asked the principal and he said, it's a pet peeve of ours. We confiscate every phone, put them at the door, so no kids have their cell phone during the school hours, not a single one. If they get caught twice with it, their parents have got to come and get their phones, and they don't want their parents getting their phones. So they comply. They're all engaging at lunchtime. They're forming connections again, things that we haven't seen in a long, long time. So I think a lot of it is also trying to form connections. Blue zones help with some of those things too. Other counties are taking interest in doing that. And I think the federal government, a lot of people, I've had a chance to meet, Secretary Kennedy, that's kind of in place, and to talk to him a little bit about things. His message on food and food processing resonates with everybody on all sides of all aisles. Everybody's in agreement on that. You have a lot of 20-somethings who are suddenly now interested in what they're eating, how much, much what their kids are getting, that is invaluable. We've been preaching that for 100 years, and they don't listen to the Department of Health, but they listen to this individual. And if we have that, we have to ride that wave as long as we can. If we can make an impact and teach this generation how to eat properly and move and do good habits, they'll teach their kids, and that will have a lasting cascading effect down the line. So a lot of it's education. A lot of it's just regaining trust. I think after a pandemic, for a lot of folks, they don't have trust in public health. We're trying to regain that. And again, meet people where they're at, and just to teach them the things that'll help them live longer and quality lives as well. Because you can get older and not have good quality. You want to be able to have both. So a lot of work that's being done on those fronts. But a lot of it's also, again, movement, activity, eating right, and don't smoke and don't vape. Those will be if you do those three things, will have huge impacts. Thanks.
Thank you. And we'll talk offline about the first question. So thank you so much. Thank you, Chairman.
All right. Thank you. Next on the list, Representative Love, you're recognized.
Thank you, Mr. Chairman and Commissioner. Thank you and your staff for what you do. We know that you do great work. I had a question about your efforts around sickle cell disease and what the department is doing.
Thank you for that question. Dr. Amerson is an expert. Actually, he probably even started getting a bit of a national expert on this topic. This is something that affects, I think, 1 in every 365 children, African-American children. It's a disease that for a lot of them is obviously lethal, very painful, huge issue. We would like to have more focus on that as well. But Dr. Amerson, I'm going to let you, I know she's going to be chomping at the bit to talk about this.
Thank you so much for the opportunity to talk. So I am a parent of a child with sickle cell. So this is an issue that hits very near and dear to my heart. We were able to find a position within the department that we're going to repurpose to create a sickle cell program in Tennessee for the first time. A lot of our neighboring states have had one for decades, but Tennessee, for whatever reason, has not. So that's the first thing. We are working with the CDC and the Sickle Cell Data Collection Initiative across the state, particularly with UTHSC and Vanderbilt, to be able to take some of the data they're collecting from hospital discharge data, vital records, whatnot, to be able to really get a good sense of how many patients we have. We have a lot of ideas. It's still very fledgling. I would love to connect with you offline about this.
All right.
Thank you, Commissioner. I'll connect with you. Thank you.
Thank you.
Thank you, Representative Love. Next on the list, Representative Reeves. Go ahead. Delight, for some reason, that microphone
Oh, it
slot
doesn't
does
work.
not
Okay.
come on. You're good to go.
Well, thank you, Commissioner. Appreciate you coming out today. Question about some of our chronic disease, specifically diabetes. A recent report on diabetes in Tennessee says that about 14% of our adult population has diabetes, another 14% has prediabetes, and 1 out of 5 folks that have diabetes don't even know that they do. Can you talk about the Diabetes Prevention and Health Improvement Program and what that is doing and how that's going?
Thank you. So it's, again, it's a lot of this is education, and a lot of it's related to our obesity rates, obviously. So diabetes has 2 different types, type 1 and type 2. Type 1 is people whose pancreas have failed, so they don't manufacture enough insulin. And type 2 is more of an insulin resistance type of problem. It can lead, having uncontrolled diabetes can lead to renal failure, strokes, heart attacks, peripheral vascular disease, so many things. There's a lot of link now towards dementia as well. I think there's a lot of link towards the development of that. That's what the current studies are showing. We try our best to be able to educate people on this. We try to become a resource for our community. And again, I'm trying to at least go throughout the state, talk to our providers to let them know, hey, if you need a resource for people that are aging, for dementia, for diabetes, for anything that you don't have time perhaps to sit down with your patient and talk to them about an education, rely on us as a health information center and as a side resource for you on that. But if there's specifics, I know Dr. Amerson, probably have a little bit more detail on our diabetes program.
So some of the things that we're working on at the state level, we always have the diabetes educators, which are located in many of the local health departments. In addition to that, they have a diabetes self-management program that basically teaches patients with diabetes how to manage their diabetes on their own. Also, one of the things that we work on that a lot of folks aren't aware of is our built environment grants work alongside with Project Diabetes to do community evaluations to improve walkability, to improve access to healthy foods. And in doing so, they're able to increase the amount of exercise people are getting in their local communities. And then the last thing I wanted to mention is our work with coordinated school health over in the Department of Education. We are working a lot specifically around type 1 diabetes in terms of education for the school nurses there.
Representative Reeves.
I'd like to talk to you guys offline about ways to get ahead and identify it earlier, but I appreciate you guys coming out.
You would welcome that. Thank you.
All right, thank you. Next on the list, Leader Camper. And just as let everybody know, we have about 7 people on the list and about 7 minutes to go. So not rushing anybody, but if you could just get to your question and get to your answer, that way I just want to keep everybody on time this morning. Thank you.
Thank you,
Leader
Mr.
Camper.
Thank you, Mr. Chairman. Thank you, Commissioner. I'll ask the questions. You can get it back to me later. Has the state funding for HIV remained at the same level since we had a switch from using federal dollars? And are we using some of the same partners in there? You can get it to me later so we can get to the other people. The other question is around this elevated level of new HIV infections in Shelby County. And I'm curious if you all have sent additional funds to Shelby County to help with testing in Shelby County area.
I'll be very brief on the response. The amount that we're giving is the same. We're the only state in the union with our current model, and we're the only state who's not worried, fortunately, about where our HIV funds are coming right now. And I give that credit to the General Assembly for investing in that. Most states are worried about where their monies are coming from right now. We are not. Shelby County is being able to hire more folks. They have more people in the field using that funds. I think the expectation they're going to use all of their funds. They weren't able to do that with federal funds before. So there's more out there. We're doing probably 50% more testing than we ever did before as well. And as a result, we are capturing more people that have the disease because we're doing more testing. So the hope is as you catch them, you get them into our Ryan White program and they can get treatment for it, which is a very, very successful program. So we're making good strides. There's more, the numbers are gradually going up. I think we have more population in the state's part of the reason. And we're doing a lot more testing and capturing people, which is the hope of the program.
Thank you, Mr.
Thank
Chairman.
you.
Thank you, Commissioner.
Thank you.
Thank you. Representative Capley, you're recognized.
Thank you, Mr. Chairman. I can just ask my question and email, let the other members go. I appreciate it.
Okay, thank you. Moving right on, Representative Miller, you're recognized.
Thank you, Mr. Chairman, and thank you, guys. Going back to the Health in Tennessee slide, you actually answered the questions. But my question to you, understanding this is a budget hearing, are you all monitoring any legislation that's being introduced by us that can overall reduce our position as bottom of health in this country?
We're monitoring. We're always monitoring legislation, Representative. We have a team, an excellent team that does that and works and tries to help get our members to achieve what they want in their legislation. There's obviously a lot of efforts on things that we could be doing, and we're looking forward, again, having more of an opportunity. I'd love to talk to anybody when it comes to health and health outcomes of the importance of what we're trying to get done. But there's a lot of things that we can do. I've told our team we try to attack things that are obvious people expect us to work on. If heart disease and cancer and people expect us to work on those things, let's work on trying to reduce tobacco, nicotine use, and get people moving and trying to get that message out there.
Okay. Second, last question. In reference to major programs, Tennessee Medical Cannabis Commission, what's going on with that commission? Why do we need it? Is it effective? What is it doing?
I don't know if we have any experts on that. Yeah, go ahead. Yeah, go ahead, JW.
JW Randolph, Deputy Commissioner. Happy to follow up with you, Representative. My question. Thank you.
Thank you.
All right, thank you. Next on the list, Chairman Grills, you're recognized.
Thank you, Mr. Chairman. And I see the overdose there at 48th in the nation. Dealing with with that perspective in mind, how often do we see Narcan administered in schools? How often are they in elementary schools, junior highs, high schools? How many dollars a year are we spending on Narcan? And maybe you can just real quickly give us that.
Yeah, we give them out to our health departments. We've run out in our health departments from giving out so many. We keep asking mental health, which is one of our partners, to work on that. Dr. Jones, maybe you can provide us a bit more information on some of the specifics.
I don't have the precise data for schools, but it's Department of Mental Health and Substance Abuse that reaches out to those community partners. We primarily dispense it just in our health departments. We've been spending, I think you asked about money, $600,000 to $700,000 a year. That for the health department funds, that's been one-time funds, so it's not recurring, hence us having to ask mental health for that. But in terms of community outreach outside the health departments, it's primarily from them.
Chairman Grills, you recognize.
Thank you, Mr. Chairman. And we'll just get back on some of those other things. I'm very interested, though, to see how often we're seeing Narcan distributed in elementary schools or intermediate schools or junior highs, whatever school you can think of, because I'm hearing over and over again that they're using them, but yet we're not. These are just rumors, and I'd like to see some real hard data. Thank you.
Thank you, Chairman Hulsey. You're recognized.
Oh, thank you. Thanks, Doc, for being here. You started meddling there when you started talking about people eating too much food. I was getting so big, my bathtub had stretch marks, but I went to the health department. They wouldn't give me a new bathtub, but I appreciate you trying. Two questions, and that's all. Out of 64,500 tests for syphilis, how many came back positive? And the second question is, people who have never smoked but have lung cancer, the percentage of that, where do you think that comes from?
Well, it's a theory. I think a lot of it's secondhand smoke. Radon has been shown to be linked to a lot of lung cancers as well. People that have high radon levels in their homes can have a higher rate of lung cancer. There's probably other sources and other causes that we don't know of that are environmental that we're going to be learning about, I think, moving forward. A lot of things that we're seeing people exposed to for higher breast cancer rates, other kinds of lymphomas. But I would say secondhand smoke and radon are probably your biggest exposures to people that have not smoked. Your first question, however, Dr. Jones, maybe you can provide some information.
Most testing is done by community partners, so I don't have a percentage. I would say, and we've had 60 some cases of babies that are born whose mothers have syphilis. And I think when I started with the health department, it was about 2 a year. So it's just an unbelievable rise. And that's why we're asking for money to improve our testing at the state lab.
We have the specifics. I think the number is up to 3,813 was the latest level of total syphilis cases in the state out of those people that were tested. 138 of those were congenital syphilis, which are babies that are born, either stillborn as a result of that, or will have lifelong problems from syphilis. That's gone up exponentially in the last several years. So we're at the highest levels we've seen since the 1960s.
All right. Thank you. And the last person on the list is Representative Sparks.
Yeah, I'll make it real quick. At least we're 28th on volunteerism.
There you go.
Wanted to ask about the Nashville's Forensic Center serves 52 counties. Mayor Carr back in Rutherford County, they've been pushing for a new forensic center. Can you elaborate on the need for that?
I think there was a report that was put out that I think was made public that did the analysis on that determined that there would be a potential need for that. I think I've had a chance to talk to the mayor about this, I think, as well. And I know there's a local effort to be able to try to put something together, I think, locally if they're planning on moving forward on building a facility there.
Something that surprised me, I was with a group called Mothers Against Murder last year, and I was surprised at the lack of, I guess, prosecutions due to the lack of the forensic results coming back. Have you heard much of that?
I have not personally, but I know that we've got quite a few forensic centers, obviously, throughout the state, and that was part of, again, ARPA, out of what came out of the entire pandemic, there was a need to make sure that we had enough resources to handle the amount of volume of people that can be expired and be processed quickly. So I have not heard that from you.
Thank you. Love your enthusiasm. Thank you, sir.
Thank you.
All right. Thank you. And I have no one else on the list. Representative Miller.
Thank
Yes,
you.
sir.
Going back to health in Tennessee, we're at the bottom. How much does poverty have to do with our position in this country when it comes to overall health?
Yeah, I mean, poverty is linked to health. I think all the statistics and data show that people, if they're poorer, they will have worse outcomes. So obviously, the less poverty you have in a state, the better that people will do in terms of that overall. And we do a lot of work because that's kind of the field that we're in. People that don't have insurance, people that have maybe are vulnerable in that regard, we try to get them connected to social determinants and try to improve their station in life. And people that may feel like they have nowhere else to go, we invite them. Please refer them to us. We'll get them plugged in. I say we're the party planners of state government. We get them connected to all the resources that are out there at any age. So if you find people that are vulnerable, that have a situation, please come and see us. We'll get them plugged in and can provide them and help get them connected wherever they can.
Thank you. Thank you, Mr. Chair.
Thank you.
Thank you. All right, members, I have no one else on the list, so I would like to thank the commissioner and your team. Thank you all for being here. Thank you all for answering our questions as well.
Thank you, Mr.
All
Chairman.
right. We will transition on over to the Department of Safety and Homeland Security and Commissioner Long.
Wait, nobody in here. We just do like a 15-minute recess and come back. You don't want them, we'll take them. Before I go into the
All right, Commissioner Long, thank you and your team for being here this morning. And I'll just remind our presenters that I will control the microphone from up here. So you just wait till the red light comes on and you may begin. Good morning, Commissioner.
Good morning, sir.
And you can start if you'll just make introductions, and it's all
Okay.
yours.
Thank you. Mr. Chairman, thank you. Members of the committee, thank you for allowing us to come and present our budget to you this morning. I have Sonia Headley, the finance director, Elizabeth Stroker, our director and general counsel for the department, Colonel Matt Perry with the Tennessee Highway Patrol, and Assistant Commissioner Greg Mays over Homeland Security with me. Thank you for allowing us to present before you this morning. I'd like to take just a small amount of time, sort of bring you up to date on some things we've had going on, and then do our budget and give you plenty of time to ask the questions that you may want to ask. I just wanted to let you know that during the recent disaster in East Tennessee, we had 160 troopers assigned to relief up there per day. We also had aviation up there. Our aviation did 70 flight hours. Individuals rescued was 100 or more. The THP for the last year has had a 92% increase in calls for service. They've had a 183% increase in the Memphis area on traffic stops. We've had 22 cadet classes. If you'll remember, we've changed our training mode from once a year to quarterly. Every time we get through with a cadet class, we start another one. So we've had 22 classes. We've recruited 3,842. We've hired 1,075. 574 have graduated from those classes. Homeland Security. We now have a special agent assigned to every county in Tennessee. We've worked over 1,000 school threats so far this year. On an average, it's about 6 per day that we're seeing across the state so far. In the SRO grant that you allow, 1,378 schools are covered. 95 counties are benefiting from the SRO program. We've dispersed $103,350,000 for the SRO so far. The Houses of Worship grant, 500,000 was funded, 9 awards, 30 applied. We had 1,000,007 in request, and we're only able to do the 500,000. In 23, it raised to 750 in 24, 750 in 25 with 14 awards, 400 applied. So if you can see, it's a very popular program, but we have criteria that we look at to try to be judicious about it and review those applications and look for the worst of what they need, who needs the money the most, and try to allocate it according to that. Then last, our communications network. You've heard me say every time that I've testified as commissioner that it's a shame we're waiting this long to get first responders on an interoperable system in Tennessee to where all communications can be done together with our first responder partners. And I'm glad to tell you we are way into the building on that. We have some terrific numbers on the number of counties that have joined in on the TACN program. We've got over 20, or I think it's 200 tower sites we're looking at total. We're building those out over a phase of time. We've had several counties that have reached out and joined us. The good thing about that is it's helping us save money, because if they already have a tower site that we can utilize, it saves us having to put a tower site in that community. If they don't have one, we're able to help them by us building a tower site and also putting their equipment on our tower site. We have already finished out and I have Director Gray here from TACN with me if you need to know, but large amount of the ambulances across the state have been furnished radios already. The good thing about that, we feel like we're saving lives every day, and we'll save lives because an ambulance now is able to talk to a trauma center from out where they are rather than waiting till they get real close to the trauma center and able to talk to them. Under contract, just to give you an idea of some of the counties that we have in the first March 26th completion: Haywood, Sequatchie, Lawrence, Henderson, Maury, Giles, Moore, Putnam, Shelby, Haywood, Tipton, and Carroll. And then under another contract for July of 26, Grundy, Van Buren, Cumberland, Dixon, Coffee, Morgan, Ray, Warren, Franklin, Bledsoe, Sequatchie, Hickman, Marion, and Sevier. And then under co-contract with existing towers, we have Robertson, Bedford, Arnold Air Force Base, Montgomery, Sevier, Warren, Cannon, Dixon, Grundy, Macon, and Williamson. And as I said, 18 new sites, right at 20 sites for April of 25. That's some of the things that we wanted to bring to your attention to let you know about some of the allocations you've prepared for us in the past to give you an idea how the money's been spent and what progress we have made on those. Starting with this year's 25-26 cost increase. Number one is our statutory salary step raise for our state troopers, $3,085,000. Number two is a salary survey that you know is done for the Highway Patrol with the surrounding states to compare salary of other departments and other agencies in those surrounding states. That survey was $4,239,000. We have been trying to build out our trooper positions. When I started as commissioner in 2019, I think we were allotted 900 positions. We only had about 700 troopers statewide on the road. Since that time, you've been very kind to us and allowed us to increase that number. I think we've added 300, 350 troopers during that period of time, trying to build it out to what we thought was a number that would put us comparable to the other states surrounding us. In particular, North Carolina, we looked at, which had 1,300 troopers. So to help build out that program, we're asking for another 117 trooper positions and support staff this year, which is $37,909,800. The statewide school resource officer grant program, in addition to the regular amount that's been done, we found out that in every county that had a system where they had the problem students in a system or a school together, that we weren't able to provide school resource officers for those troubled areas. So education has revamped the numbers on those and added some more, and that's going to be $5 million for that. The Houses of Worship Security Grant, again, $1,250,000 to continue it. We have also had legislation before you this year where we backed for a bill to be passed called the Protective Spaces, to where we will have a zone of protection around our protectees that our troopers protect. We've had problems getting up in the face of some of our dignitaries and not giving them any space at all. This will provide for that, and the cost for that, the fiscal request for it is $113,800. We're hopefully building 4 new regional TBHP headquarters across the state of Tennessee with the Department of General Services. The rent on those 4 new facilities will be $1,036,800. We've looked in Sumner County in particular because of an overload in the Gallatin Driver Service Center and in the Nashville service centers that we have here in Nashville, trying to alleviate some of that overcrowding. In the Hendersonville area in particular, we're looking, there's about a 40% growth in driver services that's come to Gallatin, to Sumner County in the last few years that have been overflowing from Nashville and other areas. So we'd like to build a service center in Sumner County. That will be $726,000 for that. Our statewide radio system maintenance, we pay Motorola every year for the cybersecurity coverage and the maintenance on our TACN system that I talked to you about a minute ago, and that annual maintenance cost is $1,500,000. We're finding with our old system that when we inherited it on our radio system, a lot of the generators and a lot of the systems that are there at the actual tower site had not been replaced and had not had a good maintenance on it. So rather than coming and asking you every year for a great amount for all of them at one time, we'd like to get on a general maintenance program for those sites. And we think that'll be $460,000 a year. And then last, our special operations division has vastly increased the number of individuals that they've responded to assist our local, state, and federal partners on where they've had to go on barricaded subjects and things like that. Our explosive ordinances that we use for entry into those buildings are outdated, and we need to upgrade those that are not worthy anymore of being used, and the robots for that would be $866,200. Our total request is $56,187,200. Then on our reductions for the year, our operational reductions are $3,484,800, and then our reduction of equity is $1,237,800 for the next year. And Mr. Chairman, with that, we'll be glad to answer any questions that anybody might have.
All right, Commissioner Long, thank you very much for your presentation. Before we go much further, I have 2 good friends that just came into the audience back there. I have Hawkins County Sheriff, Mr. Ronnie Lawson back there, if he'll stand, and also his Chief Deputy, Mr. Tony Allen back there from Hawkins County. Welcome these 2 gentlemen. All right, we do have several members that are on the list for questions. We're going to begin with Chairman Grills. Chairman Grills, you're recognized.
Thank you, Mr. Chairman, and good to see you guys and gals. We've had lots of conversations over the past 5 years, and they've all been pleasant, and I appreciate the working relationship that we have with you guys.
Thank you.
Well, most of them have been pleasant. Some of them, every now and then we knock heads, but I really appreciate y'all's work and the work that you do. You were asking about, we were going to ask a couple of questions about the retention issues that you've had at the driver safety. Do you just want to take that from the 50,000 foot view, or do you want me to get more specific?
Chairman, thank you for the question. I'll be glad to try to answer it. And then I got people from DL here that can probably answer it a little bit better. Our retention has really been better because of the increase in salaries that we were able to provide some of the front level individuals in our driver services center. We have utilized all of our other positions. I think we only have like 40 something vacancies, maybe in statewide in driver services that are still on the books. The old figures that you probably have seen are a larger number. Those are not accurate. We have about 47 statewide right now. So we're able to hire and retain. We do have some turnover. It's a hard job where individuals are there every day upset in driver service centers. But I'm happy to tell you that in my term as commissioner, it has changed. And I'm glad to say that I got complaints the first 2 or 3 years every day pretty well on driver services. And now I actually get more compliments with our personnel than I do on complaints. We've dropped, if you'll remember, in 2019, we had an average of about 3-hour wait times in driver services center. And we have been able to tremendously reduce that. And I hate to use wait times because sometimes it's measured when you come through the front door, sometimes when you get ready to go to the counter. So I'm hesitant to use that. But our average right now in the smaller populations is about 24 minutes. Metro and Memphis and some of the larger areas, or in Williams County, some of those are a little bit larger because of population issues, but the services are much quicker. We have tried every way possible to try to automate our driver services so people can do it online instead of coming to our driver service center. We've changed the operational flow in our driver services center to where we have an individual that meets you at the front door, asks you what service you need, and can direct you to wherever you need to go rather than you not having any idea which counter you need to go to. That's been a tremendous help trying to get the flow better too. So we're well pleased right now with our operation.
I had to get my license renewed back in October, and it was very seamless. I mean, just real quick, fast, in a hurry. I really appreciate that because I was in a hurry. You have 6 new positions in the budget for Sumner County. There's 11 long-term or 11 positions that haven't been filled in over a year. Is there a chance that you could take those positions and not have to create these new positions, these 6 new positions in Sumner County?
I'm going to ask Deputy Commissioner to come up, and he knows those positions.
Good morning, sir. Les Delente, Deputy Commissioner for the Department of Safety. I believe, without saying the position numbers in front of me, but you're talking about those positions that are for Montgomery County. We have a new center that was funded last year that should be opening in, I think, May of this year. And so those positions will be moved and filled for that.
Are some of those positions that that are not filled now, which you said 47?
Mm-hmm.
How many of those are over a year?
I don't have that answer at this time, but we can get it for you.
But you've got 6 new that you're going to create for Sumner County.
Yes, sir.
I guess my question is, could you take some of those and not create the new positions? That's really what I'm trying to.
Yeah, no, sir. As the commissioner mentioned, they're scattered across the state.
Okay.
And I mean, you got retirement and people leaving on a daily method. And so those are just simply replenishing those. So.
There we go. Elizabeth Stroker, Legislative Director. And to add on to that, those larger vacancies that you see are in your more metro areas where it's a little bit harder to keep people around. And so we're hoping eventually we can get to a point where we can fill those spaces. And so we don't want to get rid of them since that is the highest need when it comes to volume.
And last question right now. Last year, we changed the law on hardship license and how we could, how families were able to take advantage of online courses. Have you seen a lot of use in that? And is that something that's been helped?
As far as the online courses being offered for people who want to go through the driving school, I don't believe we have had any schools that have signed up to do that online. I'd have to go back and check since it is optional for those schools if they want to offer that. But I'll certainly look into it with our driver testing team and see if we have any schools that have signed up.
Thank y'all so much for working with us.
All right, thank you. Next on the list, let's go to Representative Reeves. Representative Reeves, you're recognized.
Thank you, Mr. Chair. I just wanted to note that we've got some great Williamson Countyans in the room, Chairman Long and Colonel Perry, and I appreciate the work that you do. And I know that our county is in good hands with you guys at the helm. And how long does it take from recruitment to putting a new trooper on the road?
Thank you. Colonel Matt Perry, Tennessee Highway Patrol. I appreciate the question. So I always like to just speak briefly about the past. We would hire 1 cadet class a year before you started giving us positions, the General Assembly, that is. And so we hire every quarter now. So we start a cadet class and hire for the next cadet class basically within a week of each other. And so we spend 3 months doing all of your all the things it takes to become a trooper, backgrounds and psychologicals and medical. But from the point you apply to the point you start a cadet school is roughly 5 months, give or take. And that changes because one thing that we changed also is you could only apply for a 1 week period or a 2 week period. Now you can apply every day, all year long to be a trooper. So some people might apply, just missed the deadline for a cadet class. And so theirs might take just a little bit longer, but some will take a little bit less than that as well.
And do you feel confident that we're going to fill all the new positions that we have?
Yes, sir, I do. We've got roughly 40 vacancies. We've got people retiring this Friday. Our number changes a lot, but we have recruited, hired, and retained very well.
Okay.
Yes, sir.
Thank you, and thank you for your service.
Thank you.
All right. Thank you. Next on the list, Representative Freeman, you're recognized.
Thank you, Mr. Chairman. I have 3.5 questions. Can I just ask them? And
You can start with a half.
Yeah. Thank you, Commissioner. So I've got first question is the House of Worship security grants. We did 14 with $750,000. How many do we expect to do with 1.2? And what does that process look like? Are we going back and verifying they do the work? Are we just sending them money?
No, we're verifying, but I'll let Deputy Commissioner Mays.
Good morning, Deputy Commissioner Greg Mays with Office of Homeland Security. So the process, let me speak to the process first. We, as you saw from the statistics, the Houses of Worship grant has gotten very, very popular. It's grown. We had about $20 million in asks last year for only $750,000. So as the applications come in, we set up a review board made up of Homeland Security agents and leadership. And we review each application and score them according to a demonstrated need. And it's a bit subjective. It has to be. We have to make a decision with limited resources, which is sometimes difficult to do. And then we come up with different options, courses of action on how much to fund. So, for example, a church or a synagogue may ask for a $50,000 grant, but we're only going to give them $30,000 because that allows us to fund more down the line. And so once we make a decision on how we can fund the most with the amount of money that we have, we make those awards. Now, to the checking up and verifying and how that goes, this is a reimbursement grant. So it'll pays for armed security at houses of worship. So whether a church or a synagogue or a mosque or whatever, they submit receipts and invoices, and we have some requirements on there and on what should be included. And we review those and then make payment when they have submitted an invoice.
Thank you. Second question, somewhat or not related at all, actually. So the $726,000 for Driver Service Center in Sumner County to deal with overflow from Davidson County. As a Davidson County resident, I get calls all the time. I can't get an appointment. How do I do it? And explain to me the logic, because I'm not sure I'm understanding of building out the facility that's acting as the overflow to assist more overflow as opposed to addressing the root problem of another center in Davidson County.
Thank you, Representative. I think the best way a lot of people from Sumner County are coming to Nashville, increasing our traffic in Nashville also with the growth in Nashville too. So we feel like if we can get the Sumner County office, that will take that group back and surrounding areas that are also coming to Nashville in that outlying area, and it'll take relief off of Nashville. But we still see a tremendous amount of Hart Lane area in Nashville, our other Nashville centers. We have full staff at those centers, I believe it is now. We've added 1,400 Real ID appointments recently. People are waiting, unfortunately, to the last minute to get the Real ID in May. We've added 1,400 appointments recently statewide for people to be able to schedule to come in to where they don't have to wait so long. But Nashville has continuously been an overload problem. And I don't know, throwing more personnel with it in Nashville will solve that problem, honestly. We're trying to do it in the outlying areas to get them to come out away from those populated centers to try to relieve those some is what the answer is.
Okay, thank you. Thank you for that. And you just hit on the Real ID. I'd love for you to give a quick PSA about encouraging everybody to do it, because you're not going to be able to get on airplanes. It's going to limit people's ability to move around our state. Do we have data on how many Tennesseans have done it? What do we have left? And here's my half question. If you have someone who's 15 who gets their learner's permit, do they automatically qualify for the Real ID when they turn 16? Or will they have to go through that process again? Asking selfishly as the father of a 15-year-old and a whole group of other 15-year-old parents have asked me that question.
And I second that, Chairman Freeman.
Yes, sir. And as you all know, we're doing a Real ID event in 2 weeks here at Cordell Hall, and we've been doing press tremendously. Our Assistant Commissioner Russell Shoup is all over the news and media when it comes to airports and getting out to the community that this is happening in a month and a half. So if you have someone who comes in at their very first time, if you bring all those documents to get that Real ID issued at their first issuance, you shouldn't have to do it again. So if you've already done that, you'll be good, and it'll automatically roll over to the next credential that they have.
Is that what they automatically require to get your learner's permit, or is there an additional?
So Real ID is not mandatory. When that law went into effect many years ago, it was the will of the General Assembly that it's optional to get your Real ID. So most people will take advantage of it. I think you might have. We'd have to go back and look. But if you brought all those documents in and they asked, would you like to go ahead and get a Real ID?
I don't think I was asked, but we can talk about that also.
We'll talk about.
Yeah.
We'll make sure that it gets
Okay,
sorted.
Great.
Yes.
Thank you. Thanks again. Thanks for what you do.
All right. Thank you. Next on the list is Vice Chair Gillespie. You're recognized.
Thank you, Mr. Chair, Commissioner, Colonel, team. Thank you all so much for being here. You all know how big of a fan I am of y'all's, and I will continue to advocate for y'all in every way possible. Switching back to, and Representative Reeves said or asked some of my questions, but just following up with the new troopers and how many of those have been funded so far. And it looks like there's still, as of a couple days ago, according to Edison, there's 82 vacant THP positions. And just have a couple of questions here regarding that. I guess, first of all, what, without repeating what Representative Reeves said, what would you say the biggest holdup is in terms of filling these vacancies? And try, I guess, from a statewide perspective, not a regional perspective, if that makes sense.
Yes,
and then
sir.
I've got several follow-ups.
Thanks, Chairman. Colonel Matt Perry, Tennessee Highway Patrol. The 82 vacancies, what Edison doesn't account for is we have 40-ish overlapped positions, which it's just simple math. You subtract overlaps. We actually have about 40 vacancies statewide. I think we've been just a little bit lower in the last couple of years, less vacancies, but you've given us positions as a body the last several years, so that number keeps going up, but we are filling them. I don't think we have a whole lot of issues hiring. I mean, the way we're doing it, the way we've changed our process is really helped. But we got 100 new positions this past July 1, and that takes, unfortunately, about a year to get new positions like that filled, because we were already filling the positions from the previous year. I mean, there'll be a point when we don't ask for any more positions or you don't give us any more, and we will get full. When we've got a class starting in May, we offered 121 people a job. That number, if they all started and graduated, we would be over full. They won't all start, they won't all graduate, but I think we're doing really well from Memphis to Mountain City hiring.
Well, thank you. And that explains a lot right there. And I definitely understand that. What is, and I've got a couple other questions, but what is the percentage? Is there an average, say, an average rate of completion of the troopers once they're hired and the academy starts? what's the fail rate or the percentage of the pass rate, or however you want to word that?
Yes, sir. So I'm going to give you anecdotal. We have those numbers. Our HR division tracks everybody coming in, everybody application to showing up for the interview to, passing the interview. I mean, they track it all. We can give you, but I can give you anecdotally because you can kind of see the numbers, the recruitment numbers, the hiring numbers, and the graduated. They basically speak to that. We'll have 1,000 people will apply for a job. And we have repeat applicants, but 1,000 people will apply. Half of those people actually will schedule an interview to come. Roughly half will schedule an interview. Roughly half of those people will show up on interview and testing day. And then we offer, so of that half, there'll be roughly 150 or 60 people that we can offer a job to. And you heard me, we offered 121 this last go around. I mean, but we're in a good place. There was a time we had more jobs, more offers than we had people to offer. Now we're able to, select, and we have a criteria. We don't just, randomly choose. I mean, you've got to get a certain score, and obviously veterans, military veterans, law enforcement, people with, college degrees get some preference.
Thank you. That's, I think, helpful for the entire committee when asking these questions. Last that I have, and this is kind of back to the first question, but more centric to Shelby County. There are a lot of incentives that y'all are doing, and I know that causes some heartburn for some other agencies that are nearby with their recruiting. And without getting into that component of it, how are those extra incentives working for Shelby County? Where are we right now? In my opinion, we're not where we need to be. We need more troopers there. We need more funding there. But where is that right now, and how is that working?
Yes, sir. We've come a long ways in Shelby County. I think you'll agree with that from where we started. The incentives that we do for the troopers that work there is paid off. I mean, I've said it, I think last year, certainly the year before when we asked for that incentive. Troopers don't transfer into Shelby County, and troopers don't transfer into Davidson County. Busy, high call volume, counties, they just don't, because we put new troopers in those metropolitan areas, and when they get to a certain, years of service, they're ready to probably slow down a little bit on that. They're not looking for, pursuits and all the things that a young trooper, but because of the incentives, we have troopers. I mean, a sergeant just transferred into Shelby County. We have troopers regularly wanting to transfer into Shelby County. So it is making a huge difference. People are staying there and going to Shelby County because of that extra money.
One last question. Thank you so much. I really appreciate it. And again, I'm not trying to grill y'all here. I'm just simply asking questions. Lastly, just for the audience listening out there in the internet and land or wherever, what is the best way if, you're on 240 or Interstate 40 or 65 or wherever on a state road where, there's patrolling of your troopers? What is the safest, best way to report bad behavior? I mean, I don't know how else to put it. Not 911 life-threatening behavior, but just bad behavior. Or is that just a waste of time? Like, where should people go for that?
That's a great question. They definitely should report it. It's not a waste of time. But Star THP, Star 847, anywhere in the state of Tennessee will get you to the nearest dispatch center without calling, 911. But there are times where 911 is probably appropriate too. And I don't mean, if somebody's driving in such a reckless manner that they're going to cause a crash, hurt someone or certainly themselves, and then that can be reported 911. So people shouldn't be afraid to do that. We don't want to bog down the system with unimportant things. But Star THP for anything. You see a car on the side of the road that maybe just has a flat tire, or somebody's driving a little aggressive, but not to the point where you think they're going to hurt someone. Star THP.
Thank you all so much. Really, really appreciate everything you'll do.
All right. Thank you. Next on the list, Representative Shaw, you're recognized.
Thank you. And thank you, Commissioner. Thank you, Carl, for being here. And certainly I'll echo the fact that I love to see troopers out on the roadway because when I see them, they make me feel better. Couple of questions. First question is for the commissioner, then I have one for Colonel. I'm on the board of the community rehabilitation. We work to make sure that people with handicaps get fair wages and so forth. And some of our people clean a lot of the centers, driver's license centers and all. And I know this has nothing to do with you all, but I guess, Commissioner, my question is, the clash is they can't get in the centers till they open up in the morning time. And at that time, your staff is in there, so they can't clean. Is there any solution from your perspective as to where those staff members could get in and clean up before maybe your staff start? We've been having that problem, and I'm not for sure if that's something we can get solved, maybe with someone opening up early or something of that nature.
Representative Shaw, thank you. We'll certainly work with you and see if we can resolve that issue. I didn't know that was the case. I do know we have certain times we won't even let our employees in until a certain time because security issues. We had an incident back a couple of years ago where one of our supervisors was allowing people to come in early and was issuing credentials that probably should not have been issued. And she was later convicted in federal court on that case. And that caused us to really get strict to not allow anybody to get on the system prior to the hours of operation. But as far as cleaning the offices, I'll work on that and I'll get with you personally and let you know if we can get that resolved.
I appreciate that because these are just people who are trying to get in and clean up, and of course it's through JLL and it just caused a problem. Then to you, Colonel, thank you so much. And here's my complaint, and I think you heard it before. Tell me, and I know troopers have a right to patrol anywhere in the state of Tennessee, but in a place like Bolivar and small areas like that, why are troopers patrol in those areas when there are full police departments in those areas? I mean, I'm not talking about stopping if they need to, but just sitting there writing tickets in the city of Bolivar. Can you respond to that? Because I've complained about that, and I'd just like to know why are we double duty?
Yes, sir. I appreciate the question. I'm, hate to hear that it's still kind of going on. When Commissioner Long came in and me, soon after, we both wanted troopers where the troopers need to be. That's on interstates, U.S. and state routes, making the roadway safer, not worrying about traffic stops in downtown anywhere Tennessee. That being said, there are problem areas, and we work with our local partners too. So we want to be a good partner. And if not saying Bolivar PD or the Sheriff's Department ask for our help, because we look at it certainly in Shelby County, we want to do the things that allow Memphis PD to do their job in the city. So if we can work 240, same thing in Bolivar, Hardeman County, if we can. We don't want the Sheriff's Department of the city to have to work crashes and spend all their time on traffic enforcement because they have other calls for service. So I'll dig into why we're still in downtown Bolivar. But you said it, troopers can stop cars anywhere in the state of Tennessee, but we're always going to encourage them to stop them on U.S. state routes, certainly our interstate systems.
And I definitely understand if there's a violation, and I want to be very clear.
Yes.
I wouldn't want a trooper to miss taking care of a violation wherever it might be, but just to set, when we got a full-time police department, and just to set downtown, and I'm just using Bolivar because that's where I live. I don't know how many other communities. I've heard Brownsville too, but I do think that troopers are much more useful out on the main highways in those kind of situations. And I would just like to see us get a bang for our buck, But I appreciate what you all do. Again, I'm going to say I've traveled in the state for 24 years, and every time I see a trooper, it makes me feel safe and feel good, and I'm in 100% support of what y'all do. I just want to see us all do it very well. Thank you so much.
Thank you.
All right. Thank you, Representative Shaw. Next on the list, Chairman Hawk, you're recognized.
Thank you, Chairman. And I'll get to a question in a moment. Personal privilege, if I could, as you announced that your sheriff's in in the room at your 10 o'clock. At the 2 o'clock, my sheriff just came in, so Wesley Holt and David Beverly is chief deputy. If you could make them welcome. I feel safer in Nashville, but I'm worried about Hawkins County and Greene County. You guys need to get back as quickly as you can. So thank you all very much for being here. To your team, Commissioner Long, we've been friends for a long time, and you bring a really great team, and thank you very much.
Thank you.
Recently y'all have helped me, and as the question about the Star 847 and THP, my daughter had to utilize that just over the weekend when she was behind a car that was weaving, had a trailer was weaving, and the trailer got sideways on it, and it ended up in a ditch, and she was able to use that, and it worked perfectly. So thank you very much for that. Commissioner Long, thank you very much. As we're looking at the budget document itself, the Department of Safety's budget has grown much like our population has grown, and we've seen influx of tourism and all that's going on, and we have mirrored that very, very well, and I appreciate you. There's always talk about federal funding and what may happen. We're looking at the green sheets. We're roughly expecting about $40 million of federal funding. Tell me a little bit about what that federal funding does and what contingencies we may have as a finance committee if and when we need to replace those federal funds.
We don't have much federal funding, do we?
It's not much.
I'll jump on this question, Chairman, Colonel Matt Perry, if that's okay. So in our commercial vehicle section, Motor Carrier Plus is what the name of it. And they obviously run the scale facilities across the state, but they also are a division that just focuses on commercial vehicle traffic, pupil transportation, school buses, motor coaches, things like that. New trucking companies coming on to the state system. So that unit receives in some MICSAP funding. The numbers changed a little bit in the last couple of years. I don't want to tell you completely wrong, but let's say the 13 to 15 million, somewhere in there we get, and that money's used for predominantly the commercial vehicle side. They fund a small percentage of troopers getting computers, because all troopers do commercial vehicle enforcement, but primarily it funds overtime assignments, it funds equipment in that unit, and their whole positions of ours in that division, commissioned and civilian positions that are funded with that money.
Okay, and just to reiterate, it is not a large number concerning our whole budget request for.
All right.
Representative Hawk, also our Highway Safety Office receives money for training for other law enforcement agencies through the federal grants also. That's the only other area that I'm aware of that has effect to us.
All right. Thank you. Next on the list, Representative Miller.
Good morning.
Good
Thank
morning.
you all for what you do. I'm on slide Office of Homeland Security, and I see where 1,000 school threats worked this school year, and I'm trying to equate the 95 counties that the SROs are in. How many schools in the 95 counties are the SRO personnel housed in?
There are 1,378 schools that have funded SROs in those schools.
Okay. And is that funding the 103,350,000?
Yes, that's correct, sir.
Are those recurring dollars? Okay.
Yeah. And I think the total amount was 140 million maybe, but now we have some of the metropolitan areas that have not chosen to participate. That's the difference in the allocated amount that the legislature gave us versus what's been spent.
Okay. So the 1,000 school threats, we know exactly what schools those threats came from.
We could probably track that, yes.
Yes. And the reason I'm asking the question from the standpoint of, is the investments of the SROs as it relates to the 1,000 threats, because that's basically why we set the program up and funded this, based on the activities in our school systems, in our districts. And would you know or have an answer on, of those 1,000 threats, how many was actually dealt with or resolved?
Yeah, let me say one quick thing, and I'll let Greg further with. The good thing about the SRO in the school is they are immediately there. When we get that threat, that SRO is there already. Our agents take a little time to get there. Other first responders might take a little bit of time after the threat to drive there. So the SRO is the immediate response, which is really good on our response compared to others. And then I'll let Commissioner Mays add to it.
Thank you, Commissioner. Greg Mays, Deputy Commissioner for Homeland Security. And I appreciate the question. It's, I think, let me start by saying that we believe that the SROs need to be everywhere. And the 1,000 plus school threats, it's not that I would rush to make sure. Well, let me say first that they are spread all over the state. They come from every corner of the state. There is not one particular school or location or region that has, a significant more threats than any other. So for that reason, and because all of the school safety research shows us that really these type of attacks can happen anywhere, at any time, in an urban area, in a rural area, we've seen just this year a shooting or in the last couple of years at a private school in Nashville, rather affluent, and at a public school in Nashville that not as affluent, right? So they can kind of happen anywhere. So it's our belief that the SROs and this SRO grant is to make an available SRO for every school across the state. And we don't really tie them to, where the threats are, if that makes sense.
Yeah, Mr. Chair, yes, it does. And Commissioner, you mentioned the special agent. And as I read, they said there's a special agent for every county.
Yes.
Is it the special agent that, I guess, respond to an incident in a particular school?
Yes, that's correct. And I want Commissioner Mays to give you the number. I was even shocked of the number of cases since you gave us those positions of Homeland Security agents, how many active investigations that we still currently have going, that we're looking at individuals who made a threat that probably were a serious enough threat that we continue watching that individual and keep in contact to make sure they get the mental health services they need. If it's a bullying incident, we get them some kind of help on bullying. But I'd like for him to give you the number so you'll know how beneficial the program has been and how many cases we actively have going on right now.
Thank you, Commissioner. It's around 127. It changes daily. The primary focus of the special agents in each county is to do the investigative work. Yes, they respond to the school, but we have the SROs there. We have all manner of law enforcement responding when there's a threat. But the gap that existed that the governor and the General Assembly sought to fill was that investigative piece, where, as the commissioner said, the special agent shows up and takes a deep and informed look at what's driving this student or person to make a threat, and are they on a pathway to violence? Do they have the two things that concern me the most, capability and intent to carry out an act of violence? And that's often not a question that can be answered quickly. It takes some investigative work, and the SROs are busy at the school. They need to be there constantly. Some law enforcement agencies in particular counties have a robust criminal investigative division that has in the past worked these type of cases. Other law enforcement agencies don't have the resources. So we take the lead on those cases when we need to. We assist when that's appropriate. But the most important thing, as the commissioner alluded to, is getting to the bottom of whether or not that person does have the capability and intent and does pose a threat. And that's the focus of our special agent workforce in the schools.
Thank you. Thank you, Mr. Chairman.
Thank you. And Deputy Commissioner Mays, let me ask you a question. Can you give just a quick update about the Homeland Security officers that we hired, a couple that we're still hiring, I guess? Can you just kind of, have we hired everybody across for each county, or just kind of an update about that program?
Yes, thank you for the question. We, with the General Assembly funding that came through, we are authorized 157 positions. We are just about there. We have filled 139. We currently have 18 vacancies. Of those 18 vacancies, 15 are commissioned vacancies, the other administrative personnel. We have a special agent class, class number 8, which will start this month, March the 24th, I believe. And we're hoping to get, we're still waiting on some psychological and physicals to come back, but we're hoping to get between 10 and 14 agents in that class, which will really bring us to almost completely staffed. We, just like THP, we have attrition. We have, people that leave for one reason or another, and we'll always have that. But we are very close to fully staffed. And I'll just take this opportunity to thank you and the General Assembly for the funding you provided and helping us do this job. So thank you.
All right. Thank you. Next on the list, Chairman Williams. Chairman Williams, you're recognized.
Thank you. First of all, I want to thank Elizabeth, Director Mays, and Colonel Perry and Commissioner for all you're doing. I know it's very difficult work to have to deal with Les every day, but he's a good friend of ours in Cookeville, and so happy to do that. But I did want to kind of piggyback on Representative Miller and Chairman Hicks's comments regarding this department. As you are well know, we spent some time out of session having some discussions about this Department of Homeland Security and the importance of it. I think one of the things that might be lost sometimes on us is the investment that the state made into these positions 2.5 years ago now is really important, not just for what's going on in our schools, because I think the focus generally in the beginning was that, but when we see what happened with the Nashville bombing several years ago and what happened in New Orleans late last year, it's important to know that for the members that the investment that we're making in protecting citizens as it relates to our schools from threats of mass violence or domestic terrorism is great. But having these individuals with the background expertise that they have can be an immediate resource for events like that are happening all too often across the states. And so I want to thank Director Mays and the Commissioner and all your staff for your diligent work there, because as threats come up, which may not be in a school, we have the resources available to use that investigative arm in order to make sure that citizens in our state are safe. And I think it's important for us to know. So I appreciate you in your hard work in that space, because I know we can keep up with all the threats that are going on in our schools and the open cases that still exist, but there are other things that you guys are also investigating to make sure that our communities are safe. And so for that, I'm very thankful.
Thank you, Chairman Williams.
Thank you, Chairman. Members, I have no one else on the list for the Commissioner. All right, Commissioner, thank you all.
Thank you so much.
Thank you all very much, Colonel. Appreciate you all being here. All right, without objection, we will now go back into session. We're back in session. And that does complete our calendar for today. Just a reminder, the budget hearings will resume on Monday, March the 17th, 2025 at 8 a.m. in House Hearing Room 1. Members, do we have any further business coming before the committee? Seeing none, without objection, we stand adjourned.